Hi, my name's Evelyn Torres, and today is November 24th, 2022. I will be discussing my case connections. And the first case that I picked was case one, which is about a newborn girl who appeared normally. And within the 24 hours, she developed lethargy, hyperthermia, and apnea. The physician suspected some metabolism disorder, so they ordered a panel of labs. A full blood workup was ordered, and this patient has blood ammonia level that was elevated and then rapidly rose up um, to very high levels. I will be discussing the normal mechanism of amino transfer in the body and the role of transamination. Also, how nitrogen transport is connected with gluconeogenesis. Um, Also, the physician have found analysis that the urine orotic acid levels were very remarkably elevated. The plasma citrulline level was normal, and I will be discussing why or where the orotic acid levels are elevated and what enzyme is deficient and which one are least likely to be impaired. And also what amino acids will become essential for this patient with this enzyme deficiency. So, ammonia production is from metabolism of amino acids and other compounds that have nitrogen. Ammonia becomes apparent in people essentially from a amino nitrogen of amino acid, which is really toxic in the body. The tissues then convert ammonia to glutamine. The formation of glutamine is catalyzed by the mitochondrial glutamine synthetase. The role of transamination is that it transfers A amino acids to A ketoglutarate acids, which form glutamate. Glutamate aminotransferase and alanine aminotransferase catalyze the move of amino groups to pyruvate, which form alanine or glutamate. L-glutamate dehydrogenase can use a NADP plus or NAD plus, and it releases nitrogen as ammonia. But this reaction that is catalyzed from the glutamate dehydrogenase is reversible, but it favors more the glutamate formation. Glutamate then undergoes oxidative deamination to the free ammonia for urea synthesis. Ammonia is packed on glutamine synthetase by ammonia plus the glutamate, which leads to glutamine, and it occurs in almost all the tissues of our body. Glutaminase levels rise in response to the high protein intake, while the renal kidney type glutamase increases in metabolic acidosis. The muscles make more than half of the free amino acids and the liver is the location of where the urea cycle enzymes that is needed for the disposal of excess nitrogen. The muscles and the liver play a big role in amino acid levels. Glutamine is taken out by the gut and the kidney, while alanine is extracted by the liver. Alanine is a major gluconeogenic amino acid, and the rate of gluconeogenesis from alanine is very high than other amino acids. Alanine then undergoes transamination into pyruvate that is then used for gluconeogenesis. Hyperammonia type 2 is where there is an enzyme deficiency in the urea cycle, which is ornithine transcarbamylase, which is known as OTC for short. This enzyme deficiency is autosomal recessive trait, which is an X-linked and is seen mostly in males and very rare in females. The elevated urine orate propose an increased production and accumulation of the carbonyl phosphate. Patients with OTC deficiency usually have low to undetectable citrulline and have normal to low arginine levels. Arginine is the essential amino acid for OTC deficiency, and it facilitates protein anabolism, and it elevates the excretion of waste nitrogen. Infants are placed on a low protein diet and a high calorie supplement with essential amino acids. The next case study that I selected was case 3, which is about a 47-year-old man who was presented with severe pain on the right toe and is unable to bear weight on the right foot, but there appears no trauma, so he wasn't hit or anything like that. He reports the pain started last night and to continue to increase severely. Based on his physical exam and laboratory findings, he was diagnosed with gout. And gout is really caused by several different mechanisms, and the blood samples were drawn and a urinalysis was performed. The patient had a 10.5 plasma rate. The normal is less than 7, and his uric acid levels was 215, and the normal range is 413 plus or minus 78. He also then says that he has recently switched from diet soda to regular soda because he read that there was fake sugar in the diet soda, and that the fake sugar was going to be bad for him. So he drinks about 4 to 5 liters of soda per day. So I will be discussing there's 3 possibilities, and I will be discussing each one and the impact of very high fructose in the body. So answer 1 was the overproduction of purines, which is, I would say, the best answer for gout. There's many genetic defects with the production of purine and pyrimidine nucleotides that are present as gout. When the serum urate levels excel solubility, it limits the sodium urate crystallizes inside the soft tissues and joint, which cause inflammation and gouty arthritis. So when there's too much uric acid in the body, your joints are filled with the uric acid, and it causes very severely pain between your joints, which causes like flare-ups. The second answer was decrease salvage of purines. So the salvage of purines pertain to the production of purines. It has purine or a pyrimidine base with a pentose sugar and phosphate group. Since the salvage of purines is the production of purines, answer 2 would not be the correct answer, because it says it would be a decrease of salvage of purines. In this case, for gout, it's an overproduction of purines. If there was a decrease in the salvage of purines, there would be tissues that can't undergo the de novo synthesis. Uric acid is secreted by the 24-hour is secreted by the kidneys and the intestines. According to the urinalysis, a normal uric acid is 413 plus or minus 78, and with this patient, it was very low. Gout is usually caused by too much uric acid in the body. Our body makes uric acid while it's breaking down the purines, but in this patient, there is an overproduction. Most of the uric acid is then dissolved in the blood and is then transported to the kidneys, where then it's removed through urination. The second possible answer was decrease urinary excretion of uric acid. And but when there is low urinary uric acid, it could be the impairment of the kidneys because it's unable to get rid of the uric acid, which can also lead to gout. However, if there is an increase in uric acid in the urine, it often results in gout, which is common in arthritis. Some patients will have gout attacks with normal levels of uric acid or won't have any. For additional information, doctors can usually do a uric acid blood test and a uric acid urine test and compare the levels of uric acid in the blood and in the urine. Some other testings that are done is a joint fluid test, which is done during a flare-up. A needle is inserted and drawn back fluid from the affected joint area. Also, x-rays would be done to see how advanced the gout is, or an ultrasound would be done to see how early the gout is if you can't see it in the x-ray. Since he switched the sugar, our body breaks down fructose and purines are released and the uric acid is produced. ATP degradation is increased to AMP. So after fructose is consumed, serum uric acid rises and the de novo purine synthesis is accelerated. In soda, it's primary sugar and the fructose or fructose corn syrup. Drinking about 2 servings a day of soft drinks increases the risk of getting gout by 85%. This patient is drinking 4 to 5 liters a day, which is very high. So the body is overproducing purines and are being converted to uric acid, which is then stored in the joints, leading to this gout.